Well, welcome to Not Alone with Melissa-Sue Methven. Today, I have a very special guest, Dr. Kriss Wallace, who is a naturopath. She's also a yoga instructor, and she hosts a wonderful women's retreat. And I happen to be a friend. We work out together at Bar 3. And one day I thought, I need to have her as a guest on my podcast because I have so many women ask me kind of my protocol with my own health journey with hormones and stress, cortisol, gut health. And I thought, since that's your platform and this is what you do a lot, so I'm really looking forward to sharing kind of your protocol, your regimen, and your wisdom with women that are listening.
My favorite thing to do, so I'm super happy to be here.
Well, thank you. Well, I feel there's so many topics that I want to dive into, but just I think the first one I'd like into is just your protocol for women's hormones. You know, that's such it's so confusing. You know, there's so much information now, perimenopause and menopause, or even I think of my daughter. She's 11 and she's starting now, you know, all the hormones and just even some information regarding those age points to the 20s, things to be aware, you know, of. So then you are prepped for those stages and seasons of life, you know. I love to hear.
Hormones for men and women are really our vitality. They're a vital part of our whole endocrine system. And they are affected by our environment. They are affected by stress. They're affected by what we eat. They're affected by our gut, our digestive system. So they can go up and down throughout our lifespan. Starting at the very beginning, like you were saying, your daughter is 11. Unfortunately, a lot of young girls are having their first periods, their menstrual cycles are starting at the age of 8 or 9, which is too early probably. And reason that's happening is we see estrogens and estrogenic things in our environment, plastics or our foods that have been contaminated, if you will, by the environment. And so that creates more estrogens in our bodies. As soon as we have too much estrogen, not enough progesterone to counterbalance that, we will build a uterine lining and then we'll have a shedding and we have a period. Those young girls are not fertile. They're typically not ovulating, but they've got so many extra hormones in their body. It's almost like their pituitary gland thinks, oh, it's time. We should be doing something about this. So that's kind of what happens in the beginning with them. As they move forward into their teens, and I've worked with all these age groups that we're talking about, women and men, but in particular women, they move into their teens and now they're very active, right? They're an active teenager, probably not eating very well. And they're also very, hopefully active. And I do and have worked with a lot of young women between the ages of, let's say, 14 and 17, and all of a sudden their periods are just a mess. Or they're not having one, or they're having too many, or what's happening. That's typically again, the stress in their life. It's because they're super active, not eating well, and their thyroid gets dysregulated. And when your thyroid gets dysregulated, so do your hormones. So we work really hard to just kind of balance out their system. A lot of them become iron deficient because they're not eating so well, because they're missing some of the nutrients that's very important for the thyroid to be working well, which is iron. And now the body's just kind of not working so fantastically and they're missing a period. So I get those girls, usually they just need more nutrients. Their nutrition's just kind of shot.
Like more nutrient dense food.
Yes,
right?
exactly. Nutrient dense food. I mean, something as basic as water. And even young girls, giving them adrenal support in the form of herbs, ashwagandha, rhodiola, cordyceps, whatever it might be, working with a naturopath or a functional medicine doctor to kind of figure out which hormone or which adrenal support would be best for them. Because anytime at any age, when you're under stress and your adrenals are going to need some help, if you're not helping out those adrenals with a little extra cortisol, your adrenal glands are going straight for progesterone because progesterone can help them work better. And as soon as your progesterone comes to the rescue of the adrenals, it's no longer there to balance your estrogen. And now those cycles just become completely dysregulated, either too long, too heavy. And when I say too long of cycles, I mean a long time between day 1 and day 1. So instead of a 28 to 30 day cycle, you end up with a 40-day or 50-day cycle. Okay. That's not the way it's supposed to be. And then once you have one, it's like miserable, right?
Yeah,
lots of
pain.
cramping.
Okay.
Yeah, lots of pain, lots of mood changes, lots of heavy bleeding. And then that leads more to your iron deficiencies. It's just like
so that's
this
the
whole
estrogen
thing.
dominance.
Yes, that's
that
the
comes into play.
estrogen dominance.
I
Yes.
have dealt with that. Okay.
Yeah.
Yeah.
And transitioning forward into, I mean, I don't mean to skip the 20s, but there's the fertile times in there. But just to skip forward, when you say I've dealt with that, that's a very common perimenopause thing, and a very common, 35 to 45, even pre-perimenopause time. It's a very common occurrence, just because we're under so much stress. We're so busy.
Yeah, we're so busy. I had little ones,
Yes.
and
Yeah.
I think when I specifically remember it is I had an 18-month-old. I just had Mateus. He's a baby. My husband is also dealing with depression and addiction, and it was a very stressful time.
Yeah.
And that's where I remember starting to have symptoms, and a lot of it started, I remember, was the gut.
Yeah.
Like I had a lot of acid reflux, but my period, I remember going to see my gynecologist actually, because I was already visiting her because I just had my baby and whatnot. My periods were so heavy, so heavy, and long, like you said. And I didn't have a lot of cramping, but the heaviness really was like alarming.
Yeah.
And I was like, this is not normal.
It's not.
Yeah.
It's not normal. It's not desirable. It's not good for your body. And it's a sign. If you have a heavy, very heavy bleed or a very long cycle, you are estrogen dominant, you are progesterone deficient 85% of the time. And it's not hard to fix. And unfortunately, in the conventional medical world, the first thing that a gynecologist or even a primary care will do is put you on a birth control pill. And there's probably, there is a time and a place for that sort of an intervention, but this is not it. This is not the place. No. And it's not the place probably when it's a 14-year-old or something that's not sexually active.
I was told to take 800 milligrams of ibuprofen.
Oh, okay. Or that.
Yeah.
Talk about your gut
know,
and
right?
your reflux.
I know.
And oh my gosh.
And then I was like,
terrible.
I said, no, but I've always been more on the naturopath. So for me, that didn't resonate with me. So I didn't go that route, kept on just getting really curious, and asking questions.
Well, and the gut, in your gut, you have estrogen and serotonin receptors that are in your gut. Estrogen being what we're talking about in the female hormones, and serotonin being a very important neurotransmitter when it comes to anxiety and calming the system down. And they actually share receptor sites in the gut. So your gut is responsible for keeping away anxiety or calming you down, and also helping you regulate estrogen. And estrogen regulates the gut, and so does serotonin. They work all together. So your mood and your hormones and your gut health, wow, they are very much connected.
I've heard that. I heard it was like 80% of serotonin is made in the gut, is what I keep hearing. And actually that makes sense, because I remember I talked to a lot of my friends too, leading up to your period, when they, and we're like, like, don't talk to me, I'm on edge, and you just know that 7 days. And this is so common conversation with some of my friends, and we're wondering what's going on. So it's so nice to know, okay, you're having the serotonin dominance, and then not enough the serotonin being created in the gut. And so
you get that estrogen dominance the week before your period in some women that have that dysregulation because you don't have enough progesterone. So that's why most of the time we will give you progesterone, and that's all we need to help modulate that mood, and even the inflammation in the your cramping and your bloating and all the things. If we just give you a little bit more progesterone, it will pull that estrogen down, and you won't have the PMS that you're having right now.
Yeah. So now because some people are really kind of tiptoeing around maybe going that route, taking progesterone or any hormone replacement, is there a natural, way that they can go about it if they don't want to? Or, for me, I'm always like, well, ask questions, get educated, listen to some podcasts,
Yeah.
read some books about it, and maybe see the benefits of it. But if you have some women that are not willing to take the progesterone, is there another protocol you have for them?
Well, first of all, progesterone, bioidentical progesterone, is natural, right? It's what your body makes. So we're just giving your body what it makes, and it's not making enough of it. So, but that being said, in a way, it's kind of a Band-Aid. Because in a way, you are where you are because of other things that happened, right? So you might be at the point of having a long cycle and also heavy periods because you were under so much stress.
So much suppression too,
Right.
of emotions.
Yes,
Yeah,
all
yeah.
those things.
Yeah.
So is there a natural way? Yeah, it is. There's a natural way, and that is through figuring out the source of your stress, finding ways to help calm the stress, whether that be sound bath, yoga, breathing, I don't know, whatever your method is, counseling, working through what it is where you, and why you're there, and looking at the gut, right? Are you eating too much sugar? Is there too much processed food going on in your diet? Do you have enough fiber? You know, are you willing to look at that piece as well, the gut? Are you exercising? Are you finding a way to balance your life with exercise? So are there natural things you can do? Yeah, there are. Are they hard? Yes, they are. And so sometimes in my practice, I always tell people what that is. You know, yes, we need to calm the stress. We need to change the diet. But at the same time, I need to get you out of pain, and I need to help you right away. And so the easy answer, and still natural, is how about I give you a little progesterone to get you there, and then we're going to work on those other things too. Yeah. Sometimes you just need a little bit of relief, and then it starts that really good healing ball going.
I love that, because I have noticed, because obviously that all plays a big role in your mental health as well. Because when I've noticed where if I'm not taking any of those things to kind of regulate, there's more fear, it seems like, more of a depression. And it really plays a big role in your mental health, because you're not building that serotonin, there's no harmony and whatnot. And the inflammation was a big one for me.
Yeah. And talking about the mental health and those two hormones, and specifically right now, progesterone's all about calming down your body and your brain. It is a very calming hormone. Most women, when they are pregnant, if a woman is pregnant at some point in her life, if you could go back to that for just a minute, depending on what else is going on in your life, typically you find that you're just you can be very calm. Like, progesterone numbers are very high in pregnancy in order to sustain the pregnancy. So progesterone means pro-life, pro-gestation, and it makes your uterus nice and fluffy and homey for the baby to live, for the fetus to live and grow. And it also makes you calm and keeps everything in perspective for you so that you can grow that life. It's pretty amazing. So when it's low, and now you have this high estrogen up here, you don't feel calm and you can't sleep. So that's why insomnia,
Yes, I had insomnia.
yes, is the number one thing that brings most often. Insomnia and anxiety are the number one things that bring perimenopausal women into my practice, because estrogen dominance can be very restless feeling and very puffy and just like an out of control type feeling. Yeah. And progesterone balances that out.
Absolutely. Yeah, I saw a huge shift introducing progesterone, and I, very open about I'm on NP thyroid, and everyone should, be on their own thing. You know, I'm not a doctor and whatnot, but this is what works for me. Yeah. Was finding that balance and working with someone that's, knowledgeable, but also for me doing my own research. So tell me, when someone comes into your office and what's your protocol? Did you get them to do obviously blood work, and do you do gut tests? Like, do you have questions for stress-related mental health?
Yeah. So what's unique about naturopathic doctors in most places, in most states, and in the most of the way we practice is that our very first appointment is an hour and a half. Like, we block a decent amount of time out for you, because we have to get to know you. We need to know you top to bottom, inside and out, because our body is operates together as one unit. So I have to know everything about you. When we even ask questions like, were you a vaginal birth? Did your mom have you
like
vaginally?
that. Oh, I
Or
love
because
that.
it affects your gut health.
Yes.
We go that far back.
Oh, this is so important because
Yeah,
I
I
really
know, you're
learned
talking
that
about
with
that.
my kids.
Yes,
Both
yeah.
kids were, well, Sophia was an emergency C-section. I wanted a whole water birth. I wanted
Yeah, all the
everything. I had a
things.
midwife
Aw.
and she had a different plan. And because I had them so close together, the doctor's like, well, just in case we should have Matea's
Yeah.
C-section. But now nobody had talked about the microbiome or, that they wouldn't be getting,
Yeah,
through
I know.
that. And even the importance of my own gut biome while I'm creating
Yes.
this baby.
Yeah, yeah.
Yeah. So,
Yeah. So
I
yeah, that's
love that
one
you
of
do
our
that.
not main questions, but that gives you an idea of how far back we go. Obviously it's, what brought you here today, and kind of breaking that down. We give all of our patients a pretty long checklist that's pretty hormone dominated, but again, everything is related back to your hormones or your endocrine system or really everything it's just all related. Yeah. So how's your sleep? What's your stress? I mean, literally this is on our intake form. What about your digestion? What about your whole female health history? Obviously, your exercise. What's your diet? What do you do for a living? Are you in a relationship? How many kids do you have? Is there a history of alcohol or drug abuse or any kind of abuse? Do you use alcohol? How much water do you drink? I mean, it's all the things. And then, when was the last time you were at an eye exam? What about a dermatologist? When was the last time you had a pap smear or a mammogram? I mean, we literally list out everything: EKG, ultrasound for your thyroid. Like, have you done any of this? Is it necessary? What medications are you on? What supplements are you on? We just need to know
very thorough.
Everything, because all of those things affect your health, and we need to know it all.
Yeah, get the big picture.
Yeah.
For
And
it.
so once we get to know you and know why you're coming in, obviously then we run pretty extensive labs. And in our office, we will run most of our labs through just a regular lab company because, we don't take insurance. You're going to pay to see me out of pocket. But if I can ease that financial burden a little bit by at least sending your labs into a lab that your insurance is going to pay for, we do that. And we can get a lot of information just from standardized lab companies. And because as long as you ask for the right.
Right.
So when we're breaking down thyroid, we're not just asking for a TSH, right? We're going to have TSH and T4 total and free T4 and free T3 and all the things. So we can get that from a lab course in our class. It's no big deal. I can get all the hormones from that. I can get all the sugar. I can get all the liver. I can get everything from that. Sometimes, if it's appropriate, we will do specialized labs. But they are cash pay. If we're moving through your treatment and it's like, well, I can't get to the bottom of this gut thing. Like if I give you kind of my protocol, like what are you eating? And maybe we should get you some enzymes. So many people come into me, oh yeah, I had my gallbladder removed 5 years ago. Okay. And are you taking enzymes? No. Really?
I know.
Because that's what your gallbladder does. No wonder you feel terrible.
I have heard that. I have actually a nephew who he's 21, just had brain surgery.
Oh, wow.
And I asked him, I said, okay, what was your protocol post-surgery, major surgery? It's only been 5 weeks and he's doing fantastic. And there was nothing about nutrition, nothing about certain. I was like, oh my goodness. This is so important for recovery. Mm-hmm. So I hear that a lot.
Yeah. It's just not part of mainstream medicine at this point. Because, again, a lot of those things are still seen as optional, as add-ons. And honestly, a lot of our traditional medical providers are not even trained in anything other than if this, then that. They're called algorithms. Yes. If there's a virus, then you give an antiviral. If there's a bacteria, you give an antibacterial. Done. So I guess maybe we can't blame them completely.
No, yeah, no, not at
It's just,
all. Yeah.
but and there is a time and a place for pharmaceuticals, and I use them in my practice. I definitely do. I use antifungals. I use certain antibacterials. I use them antivirals for things maybe that you wouldn't think of, but I do use them. So anyway, you get your labs done, and then you come back in. We go through those labs, and that second appointment's at least 45 minutes. It's going to be the first time in your life you've ever probably learned about labs in this way, because we'll take you through each and every one of those things, and then we just kind of start the process and start taking apart. It's like, I love my job. I'm like a medical detective.
Yes.
And it's super fun. I love that part of it. And I love all the different modalities that we have. We not only have nutrients in the form of food that we can talk about, and the food of and then in the form of supplements we can talk about, but we have things like homeopathy that just seems very woo-woo, but I'll promise you it works. And in a certain case, it's amazing. So you just have to, we have a lot of things we can do.
Yeah,
which is nice.
no, I love that, because I've always seen a naturopath since I was 20, and very much into preventative health, and it's,
Yeah.
and trying to educate my other friends about my journey. So that's why I thought it'd be so important to have your knowledge, and I'd love to learn more about the GLP-1s, because I think what's in the media is very confusing, and coming from a naturopath, I want to know how you use it for your patient, like what you're seeing result-wise.
Yeah. So 3 years ago, almost exactly 3 years ago, I had a patient come to me asking about it. She was one of the ones that aren't even on the market anymore. I'm not quite sure, but she asked me about using it, and I'm like, okay, I need to figure out more about what this is, first of all. And I did, and a glucan-like peptide is a peptide that we make. It's in our system. You make it, I make it. We have receptor sites in our gut for it. And I'm like, okay, it's a peptide. And we love peptides. Peptides are little pieces of protein. So they're things that we already have in our body, and we already make them, so we can just enhance them by giving you some. So that's good, I agree. But when I went to look for the peptide for her, the GLP-1 she was asking for, it was going to be $1,000. I'm like, no, we're not doing that a month. That's just not smart. We can figure this out. So that led us and I mean that the other women in my practice, led me and them down to the path of what is the GLP-1. So at that point, semaglutide, which is the generic for Ozempic, was on the market. And so we went and we did more further research into that, and find out that it is, again, a peptide, naturally occurring. Now we have tirzepatide. Rituximab is the newer one coming out. What they do is they go in when you take them via injection. Now there are oral applications and drop applications, but probably the more effective is going to still be the injectable form once a week. When it is injected into your body, it slows down digestion. And for many people with gut issues, you're like, oh, no, motility. It's all about motility. And it is all about motility, the way the body moves your food through your body, like a boa constrictor, if you will. That's what your intestines look like. And that's what they should be doing. But it slows it down. But the reason it slows it down is that it can give your pancreas some time to release insulin, and it actually helps your cells listen to the insulin more. So your cells need insulin as a carrier to bring glucose, sugar, to it. And when you are bombarding your body with too much sugar over the years, or if you have some sort of dysregulation, the cells are just like, no thanks. Like, I'm over this. I don't need any more of this. You are dead to me, insulin. I don't see you anymore. And then as soon as we start building up more fatty tissue in our visceral fat in the middle, then our body will take our sugar and deposit it right into that fat, because it will accept it. And then your cells don't have the sugar it needs, the glucose that it needs. And now you grow and grow and grow the fat in the visceral fat. So when you take a GLP-1, it sits in the receptor sites, slows down motility. Now the insulin gets to the cell, the cells become more receptive, and the glucose gets to the cell. People feel more energy because now the cells are getting more glucose, and the glucose is not being deposited into the cells, the fat cells in the center of your body. In addition, your liver is not releasing more sugars. It calms down. So there's a very good indication that the GLP-1s reduce liver enzymes. So it takes the load off the liver, which is helpful.
Yes.
And then finally, it sends a signal to the brain that we have satiation. In other words, we're satisfied, we're full. That can be a double-edged sword because now some people aren't eating enough and we deal with that.
Okay.
But for others, especially in terms of addiction and addictive behaviors, it is affecting the dopamine receptors. It is actually going there and sitting in those dopamine receptors and saying, you know what, we're good. We don't need anything else. We don't need alcohol. We don't need cigarettes. I've had a couple patients in my practice stop drinking alcohol that were most likely addicted to alcohol. I've had many quit smoking, which is a big deal.
Oh yeah.
And in addition to losing weight, now we've really increased your health outlook.
Yeah.
So it also will decrease inflammation, and we see that it decreases inflammation in the brain. And throughout the body. So there is a myriad of applications for the GLP-1s. Obviously, weight loss is what everybody wants. But the other one is lipid reduction, your cholesterol reduction. I don't like statins. I don't really prescribe them. Yeah. There are many side effects, but there's also some negativity associated with high lipids, high cholesterol numbers, if they're really high or your LDLs are really high, or if you have a history of a heart attack in your past, you need to keep those numbers a little lower. Yeah. Well, how about we just use a GLP-1? Now we have lower blood sugar, we have lower lipids, we have lower inflammation, and we probably have a lower body weight, especially visceral fat. Okay. I'm having a hard time finding anything wrong with the GLP-1.
Wow, that's good. I was hearing that a lot. The health optimization summit that I went to in Austin. Yeah. They talked a lot about it, but beforehand I did have kind of like, oh, this is not right. But I was just getting what's on social media or whatnot, but now that I'm more educated about it as to what it really does, I was like, oh, now I'm intrigued, and I think this could help so many people. I know so many women complain like, oh, that you work out 5 days a week, eat fairly well, and they're still not losing, So I'm always like, oh, you probably should see it, naturopath, functional medicine, really get the labs, your stress, it all plays a role, and like you said, the explanation of what's going on where, it just keeps the glucose or insulin resistance plays a role. So I could see that being a big benefit to a lot of people.
I have such a hard time because I'll have patients come in my office perimenopausally or even just into menopause, and these are healthy women. These are women like you. They eat well, they exercise, they are very health conscious. They are doing all the right things. And they're like, you know what? I have 5 to 10 pounds, 15 pounds around my middle. There is just nothing I can do about this. I am doing all the things. And the reason they can't is because as you become perimenopausal and menopausal and the estrogen depletes, now you don't have your metabolizer. Estrogen is very important for metabolizing body fat. Estrogen is stored in your body fat, and as soon as your body thinks it's losing estrogen, it's like, oh, no, we need to store the fat. Let's store the fat. If we store the fat, we're going to have more estrogen because your body is very smart. So you are storing more fat now because your body thinks it's going to lose all its estrogen, which it is going to because the ovaries aren't going to work anymore. So it's storing fat. You become a very good fat storer. Okay. Now, in most cases, we don't want to be a good fat storer because we can replace your estrogen. So when we replace your estrogen, it does help with some of that visceral fat and body fat in general. But you know what? We can only replace it so far. We can only do so much. We do it and it helps, but it's not the whole story. So being able to use the GLP-1s to, in addition to hormone replacement, and now really get you back to your state of optimal health is so rewarding for me because I want you to be rewarded for all the good things you're doing, and I want you to have a long, healthy life, an optimal life, not just an existence.
Yeah, not just be, okay, well, this is what we have to go through, perimenopause, and there's nothing to do about it. No, now there's enough out there that we can go through those stages and feel good and comfortable. And so, and tell me about your own protocol. Like, what do you do on a daily basis for, stress management and your morning routine. I'm always curious to what are people doing for their morning routine and your daily supplements? Like, does that look like for you?
Well, I am the guinea pig in our office, and I've always been my own guinea pig, like you just said that you were.
Yes.
I've been interested in health since probably I was a senior in high school, maybe even before that. I always loved being active, but I wasn't a sports person. I was more like a cheerleader person. But it works out well in my career now because I'm just like an ongoing cheerleader. But at that point, I always wanted to be healthy. I was always interested in health. And so I found aerobics, of course, because that was the 80s, the year I graduated from high school, which was a very, very long time ago. And I was certified to teach aerobics in 1988. And so I have never looked back. I've always been an instructor that whole time. And so to me, exercise was first and foremost. And it still is. Nutrition kind of took a back seat probably as a young person, just because young people don't eat well. And in the 80s, we ate it was all about carbs. I've seen all the trends too. So in 1989, I started my first career as a health educator. And of course, then I'm living and breathing and eating and sleeping my career, right? I could live my career, which was nice. So I feel like throughout my life, I've always been pretty healthy, never doing much processed foods. And my poor kids, we did very much fast food, and they're all pretty much into health. Yeah. But now, so as I progressed through my hormone journeys, I have 4 kids, I had 4 babies. It wasn't too bad because I was always making those food choices. I was always exercising and trying to do the very best for my health. But I was never a big supplement taker, never, because I didn't understand them. And one of the reasons, I was a health educator for many, many years. I went to medical school when I was 45. So prior to that, I was a health educator and a group fitness instructor. And I'm like, just eat healthy and exercise. You're going to be fine. And for the most part, that's kind of true, but it's hard to do all those things like we were talking about earlier. So once I went to medical school, I was really into finding out, like, what's the chemistry behind these supplements? Why would we take this over that? Who needs this over that? That was honestly one of the driving forces to get me to go to naturopathic medical school. I'm like, what's the deal with supplements and who needs them and why? So I did start taking more supplements later. And personally, menopause to me wasn't really until I was at least 54, which is later, and that probably a little bit has to do with my health and my habits. But stress relieving was always about yoga and breath work, and my master's degree is in health psychology, so I pretty much figured out the mind-body thing at an early age. But now I replace my estrogen and my testosterone with bioidentical pellets. So I use pellets on myself and in a lot of my patients. They're bioidentical. I replace my progesterone at night in a capsule. I also use NP thyroid, which is, I explain it as a quote bioidentical thyroid replacement, but it's glandular, which means it's coming from a pig and it's coming from that thyroid directly, replacing your thyroid in the same way that your thyroid produces its own hormone. So I use that. And during the day, my hormone replacement or my other nutrients kind of are, well, let's see, what do I need? I believe in glutathione as a detox, so I do take a lot of glutathione. I do supplement my hair because hair for any postmenopausal woman is a thing. And I go back and forth on those replacements. Nutrafol's a really big one. I've played with minoxidil. I'm not going to lie. I think it works for some women, but not everybody. And other than that, I do use, let's see, this morning when I took my supplements, I took my glutathione. Nicotinamide is another big one in terms of anti-aging these days and your skin. I did take my collagen this morning, but I don't do it every morning. I would say I'm in and out. And I did take DHIS this morning, which is a natural antihistamine. I was feeling a little allergy-ish, so I took that. But every morning I do my workouts. I'm a morning workout person.
Yeah, me too.
I have to get that in the morning or my day is just not the same.
The same way.
So, and my evenings are a wind down time. That's just how I do it.
Oh, I love hearing your journey. And now there's so many, I have some friends like I wanted to ask, PCO and then
PCOS.
PCOS, sorry, and then I'm not going to say it properly.
Okay.
Endometriosis.
Endometriosis.
Yes, endometriosis.
Yeah.
I can't pronounce it
Yeah.
properly. Just what are your thoughts and your belief of what's going on? I know I have mine from what I'm digging in, and it all seems, even a dental hygienist, I noticed the oral biome, gut biome, all so correlated. So I'm just curious to what your point of view is for that.
PCOS and endometriosis are both estrogen dominant conditions. These are both conditions where, for some reason, either you are taking in too much estrogen through your food or your environment, or you are not detoxing your estrogens, and that's genetic. That's something that your body is just not getting rid of the extra estrogens.
So the toxic load is so
toxic
heavy.
load is a part of that.
And I've actually been looking, not to interrupt you, but
No, it's okay.
it hits something it's been coming up a lot, is that not only is your own toxic load, but it's passed down generations.
Yes, epigenetics.
Epigenetics, yes.
Yes.
So, yeah.
Epigenetics. So, and it is interesting because even in my personal history, I can look back and see a mom who had a hysterectomy at 40, which they all did back in the day, a hysterectomy because she had fibroids. So they took both the uterus and the ovaries, which was ridiculous. At least leave the ovaries so they can do some work. So now you leave a woman without any hormones from the age 40 on.
Wow.
That's like terrible. But they took the uterus because of the fibroid. My own sister had fibroid issues. So what does that mean? That means that there is a likelihood that we are not detoxing. My mom didn't detox estrogens very well. Sister not doing it, probably not. Although I never had some of those conditions, but it is passed down, and now I do have a daughter with, I would say, a PCOS type condition that we treat. So it does, and it amplifies a little every time. So how do you break the cycle? By before a procreation, before fertility, she, for instance, my daughter, would need to get these things under control, and use supplementation and foods and exercise to try to just shift it just slightly. If she just slightly shifts now she can't shift her genetics, but she can shift the way her body is seeing her genetics and the way her body's operating to the point where, a couple generations down, maybe we could change that way estrogen's being
I've heard
detoxed.
that, like even if they knew they want to have kids, like 3 months prior, start prepping the gut, the toxic load, detoxification, and really having a healthy environment for the baby.
And there are naturopaths in Arizona and across the country that's their specialty. They work in fertility, and they work in the prep work for before you get pregnant, both with men and women.
Yeah, both sides.
I have not necessarily specialized in that, although I've had patients that are like, okay, now we want to get pregnant. I'm like, okay, well, let's do it. And we'll take care of that. And I've had patients that couldn't get pregnant, and I've worked with them most of all the time. It's just generally they need more progesterone every time. But there are naturopaths that specifically work in that particular area.
Oh, that's fantastic. Well, thank you. I have to look at my list because I had a long list of things that I really wanted to talk about. For birth control and IUDs, because this, is going to be obviously a topic with my daughter, right? And for so many. But I also know how birth control can just wreak havoc in your gut and your hormones. So what are you teaching girls nowadays about birth control, or to be aware, or IUDs as well? If they're going to be taking it out, then what? What's the process protocol after that?
Well, I mean, I want to start backwards. Backwards means I want to start with the 50-year-old that comes into me still on birth control. That is a crime, 100% a crime. There's that woman is not fertile. I mean, there is a 0.005% she is, and really not even that. She's been on birth control probably her whole life, and her uninformed physician probably just said, just stay on that. It'll keep your hormones, and you'll be fine. You won't have any symptoms. And I'm like, no. That is not healthy, because it is not bioidentical. These are not bioidentical hormones. When you take a birth control pill, it is a chemical, a pharmaceutical, that sits in your receptor sites, your hormone receptor sites, and pretends that you're pregnant. So a 25-year-old that's taking oral birth control is basically feeling estrogen deficient. So that 25-year-old feels menopausal.
Oh, wow.
That's why they're all anxious.
Okay.
And that's why they can't sleep, because it's their hormones. They've suppressed ovulation so that no eggs are fertilized, which is the point of it all. But the rest of her body is suffering. And that's why young women too, a lot of times they'll have things that they'll break bones, they'll have shin splints, they'll have, injuries in their lower leg, things like that, because their bones are not getting the nutrients either.
Oh, wow.
So that's a problem. The same with IUD. When I have women over the age of 45 coming in still on IUDs, I'm like, get that out.
Yes.
Let's take it out. You are feeling terrible because, first of all, that needs to come out. And I had a woman who was going to be seen for lymphoma. She was going to an oncologist because her white blood cells were so high. She had been through the ringer for the last 18 months. She came in to see me. I'm like, yeah, girl, that is scary. Those white blood cells do not look good. I don't know, but let's try A and B and do some, Epstein-Barr was high, cytomegalovirus was high. Anyway, long story, I said, and also you have an IUD, get that out. You know what? If your body is not happy, it's going to be creating this reaction, because the elevation in white blood cells happened about the time of the IUD being placed. I am not kidding you. We did a million things, plus she got the IUD out, and I just saw her yesterday, and all her parameters are normal.
Really?
Every single
Wow.
thing. And she was this close to spinal tap, looking, doing all the research that would be necessary if you were looking at a lymphoma.
Oh, wow.
Which is a blood cancer. Anyway, so that's the backward piece. The front piece is, what do you do with, a sexually active 17-year-old? What do you do with a sexually active 25-year-old? It's rough out there. You obviously, barrier methods are desirable because they protect against sexually transmitted diseases. And I'm talking condoms. I'm saying the nice words for condom, which is barrier method. And I will say, if he's not condom worthy and you don't have time to put that on, then you probably shouldn't be sleeping with him anyway. If you can't talk about it, then don't do it. I'm pretty open with my patients.
Yeah, that's good.
If you can't have a conversation about birth control, then you definitely shouldn't be having sex with them.
Yeah.
This is not okay. And why is it your job anyway? Like, why do you have to go out and ruin your endocrine system and take that pill every morning and not know how it's going to affect you? Why is it your responsibility? Why can't he do something? At least go to the store and buy some condoms.
I like that.
So, I
that.
I know,
Yeah.
but I realize that perhaps their effectiveness might not be as high as a birth control pill, but if it's used properly, it is. Secondly, I have patients, young women in my practice now, that are wearing their Oura rings. I don't have mine on right now, but they wear their Oura rings. They connect to their phone, and Oura Ring and Natural Cycles, which is an app, connect. I think the Oura Ring might be connecting with the iPhone apps, but I'm not sure. It will 100% map your cycle and tell you when you're ovulating. I mean, back in the day, I used natural family planning. I didn't use.
I have an app.
birth
I had
control.
an app anyways.
Yeah.
I would put it all in.
I had to take my temperature. I had to do it the old-fashioned way, and I had to know when I was fertile and when I wasn't fertile. And now there's so many ways to figure that out. And if you have a partner that's not willing to deal with your Oura ring, your temperature, your fertility, your phone, and all the things, why is he your partner? So, I mean, there's a lot of things to discuss around that. IUDs usually will not be used in women until they're at least 25, a little over. It can be painful in a cervix that's never had a baby. Yeah. So that's something to consider, although the smaller IUDs, they are using them. And I mean, my two daughters, I know both my two daughters are, they're over, 23 and 29. And so obviously there's sexual activity there, and neither of them, they haven't used any of the oral birth controls at this point. I just think you just need to have a more open conversation. You need to be willing to use other forms.
I think parents, be informed of what these will do to them in the long run. So I'm so glad that you're addressing that, because I know so many friends, they were prescribed because, heavy periods.
And that's a no. No way.
Right?
Never. I mean, this, okay. So, preventing pregnancy and sexual activity, that's different than I'm just going to give you birth control because you have heavy
I've had it
periods.
even for like people say, acne.
Acne.
My doctor, acne.
No.
And I'm like, no, but let's get to the root cause of why you are getting the acne. What's so I'm so glad that hopefully some listeners, this kind of aha moment, like, and
I have so many that try that are like, fine, I need just do birth control pill. I'm like, okay, let's do it then. Like, I'll support you. And then we have to try 2 or 3 or 4 different pills to get it to the point where they can actually feel okay on it. It's just, you are really, really messing with your body chemistry.
Okay, that is so good to know. I have a few more. I kind of asked around some women here.
Good.
Let's see here. So what are some natural approaches for managing anxiety and depression for women that you find,
Well, that's a loaded question.
Yes.
Because sometimes you have to find the source. Obviously, where is it coming from? Is it coming from what's going on in your life? Is it coming from something that's out of your control? Is it coming from your hormones? Is it something where you were, quote, fine when you were 30 and now you're 38 or 40 and you're not fine? Is it coming from the fact that you're not sleeping? Where is it coming from? So that's the find and treat the cause piece of me. That's the detective part of what we do. Let's say the answer to all those questions are, no, it's not new. It's kind of always been around. Okay. And my hormones are optimized. Okay, we're taking care of that. And let's say my adrenal glands are also optimized. So I'm taking those things. Okay. I'm exercising. Okay, that's good. I'm eating right. Okay. So we have all our boxes are checked. And then what do we do? So, naturally, there are herbs that certainly, and there are nutrients that help with mental health. One of the biggest nutrient is 5-HTP.
Okay, yes.
Yes.
I would take that every night. And my kids
Yes,
do
kids
too.
can take 5-HTP.
Yes. Yeah.
So 5-HTP helps your body make serotonin. And remember, we talked about serotonin is the anti-anxiety neurotransmitter. And guess what serotonin then becomes? Melatonin. So a lot of times when we're anxious, the reason we're not sleeping is because we can't make serotonin. We can't use any serotonin because we don't have enough to make our melatonin. Taking straight melatonin helps with sleep, but doesn't go backwards, unfortunately. So 5-HTP helps make serotonin. There's other amino acids like L-theanine and L-threonate. These amino acids are very calming, and a lot of people do very well on them. That's kind of a go-to for me. There's herbs, there's another very important neurotransmitter, GABA. Yes. So GABA and glutamate, they are on a teeter-totter in your brain. When one is up, the other is down. So too much glutamate, your brain will be too active, and patients with seizures and things like that are way over glutamate brain. Sometimes attention deficit, ADD, those kinds of things we treat with GABA. Why? Because that brings the glutamate down and then the GABA rises up. GABA is the brakes. Okay. Glutamate's the gas, GABA is the brakes. Okay. So for many patients, just giving you GABA, I have a supplement called GABA Ease that I live and die by. GABA will calm down the brain.
Will that help like the cortisol spikes that you get sometimes at night time?
Yes.
Those 2-3 a.m. wake ups.
Right. There is a supplement called Cortisol Manager that I use for that, though. I think there might be some GABA in Cortisol Manager, but there's also L-theanine, I believe, and also ashwagandha, I think, is in that too. But yes, that it does calm the brain at night. I prescribe GABA Ease or Cortisol Manager at night all the time for that. Okay. But herb-wise, calming you down, magnolia is very calming. and that's in a lot of formulas for calming people down. Magnolia is, and all of the adrenal support, ashwagandha it can be calming. But there's, chamomile, lavender, and it depends on the patient. It depends on you. Yeah. Some people do really well on something like GABA Ease, but some people do something on a different formula that I have called Catacola Calm, because that calms down the adrenaline. They're having an adrenaline issue. They're not having a glutamate issue. So it's kind of like we have to, again, still be a detective.
So personalized.
Yeah. We have to figure out what's going, and depression's different than anxiety. Remember, depression's different. St. John's wort's been around forever, and St. John's wort is an herb that is in many, many natural antidepressant supplements, if you will. And it's pretty strong. Like, there's patients that are on other forms of pharmaceuticals for antidepressant that we can't give them St. John's wort because it's additive. And that's same with 5-HTP. Okay. If you're already on an SSRI, like a Prozac, Wellbutrin, or not Wellbutrin, but if you're on like a Prozac or Lexapro, any of those, you may or may not take 5-HTP. You need to talk to a provider about that, because you could seriously cause an issue, because 5-HTP is that strong. That's strong for your body.
Okay. Oh, that's so good. I find it so fascinating. You touched a point on people with attention deficit and whatnot. Do you work with a lot of either children, adults that have ADHD or autism? Because I've noticed with neurodivergent, my daughter has ADHD, my son's probably on the spectrum of autism. No one's really, you just know, right? Yeah. Mom just knows. And I've noticed that nutrition is really key in their gut health for their symptoms. Yep. And so I'm just curious as to, if you've worked with some, and what really helps nutrition-wise for people that are neurodivergent, ADHD or autistic, because I think for them it's a dopamine, right? They're not producing the dopamine as well.
Right? For some of them, or sometimes it's too much. Okay. I've actually tested patients. So the answer to that question is yes. In my early career, I worked with a lot of kids, a lot of teens, and that absolutely led me into the ADD spectrum world. We did a lot of testing, urine testing. There was a couple companies I used a lot of their work. And we would look at all the neurotransmitters, and we would also look at fungal overgrowth, bacterial overgrowth in the gut, and come at it from all those angles. Some of them needed GABA, but some had too much GABA. Their brain was too relaxed. Sometimes there's too much relaxation in the brain, and sometimes there's not enough relaxation in the brain. We have to figure out which one it is. Okay. That's why some kids do better on caffeine to help them focus, but some just go out of control on caffeine. So, and that just kind of gives you an idea. We either need to stimulate them or decrease their stimulation. I see. So we had to figure that out. But gut-wise, 9 times out of 10, those children had a gut that was dysregulated. And you were talking about the C-section versus, so it starts sometimes when they're young, but we're able to replace the gut flora. A lot of times there's a fungal yeast overgrowth, so we kill that, and then we repopulate and we heal the gut. But many times magnesium works really well for those kids. And also, we talked about the L-theanine before. L-theanine's a big one. But finally, what about detox? Most of those kids do really well on NAC or glutathione, because one of the reasons they may be there in the first place is they were never able to detox some of the toxins that might have came in, like you mentioned, mercury, from the immunizations or just from the environment. If your child does not have those detox mechanisms, it's just gonna build up. So giving them NAC, a lot of good studies on NAC, and NAC is the precursor to glutathione. So
I've
you
tried
can just
both.
give them that.
Okay.
So we've done that. The gut, the detox, all the things. And I had a patient. She was my patient as an adult, and she finally asked me one day, she called me, she's like in tears, she's like, my 2.5-year-old just got diagnosed with autism. I'm like, your 2-year-old did? Like, that's a little early. Okay. She goes, and I don't even see it. I don't understand it. I'm like, okay, well, let's test him. So fast forward, I think he might be 7 now. We've been working with him that long and adjusting his gut, adjusting his diet. We did food sensitivity on him. They've been really good with it. All the things. He is in a neurotypical class now. He's able to focus. All the things.
I've heard that. I've heard that.
Crazy.
And I've noticed that my kids
And
are
your
on
own
my
kids,
science
yeah.
project.
Right.
So Mateus was very much colicky. He was my second C-section. And, I didn't know at the time. I was changing everything I was eating for the breast milk to be, so pure and good. But he was still having digestion issues. But I never linked it to, his toxic load. And who knows after vaccination. But now that I have all the test results for him, he was high in mercury, had parasites, high in candida as well. So we're just kind of...
Which is yeast.
Yeah, which is yeast. And why the sugar cravings
Yep,
and
that's
the
why.
behavioral. And also he was... So I'm a dental hygienist, and I noticed that even though when he was little, like 2, 3, even though he'd sleep the full, 10 hours,
Yeah.
he'd feel groggy the
Yep.
rest of the day. So then I realized that he was a mouth breather. And so I got into learning the Healthy Start, where they wear these appliances and really learn to breathe through the nose.
Yep.
And because the founder of Healthy Start, his grandson was diagnosed with ADHD and was going to put on, medication, and there's no judging on that.
Yeah.
But he was wanted to ask more questions
Yeah.
and realized it was a sleep issue, why he wasn't concentrating and all that. He was a mouth breather, and how he wasn't getting the right oxygen to his mouth. And that was also correlating to all these other symptoms that look like ADHD or autism, and changing the diet. I know for Mateus now we're doing, gluten-free and dairy-free as
Yep.
much as we can.
Yep.
This becomes extremely
It's hard.
challenging. The school treats that they get, or going to sporting events and birthdays. But now I bring a cooler sometimes
Yeah.
to sporting events
Yes.
and replacement, or I've done buybacks. So
Yeah.
I think... And it seems more and more prevalent now that there's kids with ADHD and autistic and whatnot. So, and parents are so lost to what to do. What's the
Yeah.
best? We always try and do our best we can with the knowledge that's out there. So I love that you provide that care as well. And
Yeah, there's a book called Finally Focused. Dr. Green something.
yeah, we could all find it and put it in the show notes.
Yeah, but Finally Focused is a really good one that kind of is written by a physician that I use a lot of his tests, and it has protocols in there that are generic enough, that would tell you try this or that or whatever, and supplements, and it's a good resource
So
for
do
a lot
you
of
have
parents.
I've had some parents say that their kids have ADHD and they have seizures. They'll have often seizures. What is causing these seizures that have you seen that
Yeah.
as well?
It's probably the glutamate. They probably just need GABA, and they probably need more fat in their diet.
I see.
Because fat calms the brain down. They're probably a little high in sugar and carbs and all the things that kids really want, and gets worse, if they have dysregulated gut. But it's just an overstimulation. The brain is just firing too much.
Yeah, we had even a brain. We went to Dr. Amon's clinic.
Oh,
for
yeah.
Mateus,
Yeah.
just because I couldn't piece it all together.
Yeah.
Now it's becoming clear.
Right.
And that's it. It was inflammation in the amygdala.
Yeah.
Is what they saw, and. So, they had prescribed a couple of medication, but, I'd like to prefer to try another route
Yeah.
first and make some changes, as hard as they are. I mean, for a 9-year-old to be like, okay, we're going to do gluten-free now
Oh,
and
I know.
dairy-free. But the more that I educate them, the more as to the why and why
Yeah.
we don't do in my house, no dyes, no seed
Yeah.
oils, things like that. But now they understand a bit more the whys. Of course, my daughter will be like, oh, roll her eyes sometimes. Oh, mom,
Well, I think too, a lot of the kids eventually they realize they feel better on those food choices. And even if it's kind of subconscious, they realize, oh, I kind of felt better at school today, or school went well, or, I felt good about that. And then eventually they're going to connect it.
Yeah.
with
Actually,
their
that
foods.
self-awareness,
Yes.
right? Actually, I've
Yes.
seen that with my kids, because all of a sudden they'll say, oh, whatever, Mom, and eat. I was like, okay, go ahead. That's
Yeah.
your choice.
You do you.
And then
they'll get it.
my daughter would be like, oh, I have a headache, and I had a
Yeah.
headache, and I had this, or I'm so sluggish. I'm like, well, have you seen what your nutrition has been today?
Yeah.
How are you going to get energy, and the proper energy, the lasting energy? So that self-awareness is kind of that lesson alone. So
It is.
instead of pushing it so much, I'm like, I'll let them figure it out. Even we do a lot of like cold plunge, red light therapy,
Yeah.
things like that. And one time they wanted to do a 5-day challenge, and that
Oh, cool.
self-awareness
Yeah.
of how they felt afterwards was such a great lesson. For me, it's just giving them that self-awareness to listen to their body, even for people listening today, and they're getting all this information. It
Yeah.
can be so overwhelming. Where do I start?
Yeah.
Right. And that's why having a doctor like you,
Mm-hmm.
the preventive, to guide them along, because it can be overwhelming, but also listen to what your body's telling you. You're always getting these little whispers.
Yes. Your body is your dashboard.
Yes.
It's like in your car.
Yeah.
It's
so
the-
I feel
the
like
symptoms
just
are a
listen.
dashboard.
Yes. So something isn't right. Something is not right. Keep getting curious. Keep
Yeah.
asking questions. There's so much information out there now as far as, podcasts, but I'm a big believer in finding a naturopath or functional medicine.
Yes.
That's because they're going to dig deeper.
Yeah. And you are your own best health advocate always. And no physician should discount what you've looked into, what you've read, what you've heard. I mean, it may not be right for you. It might, whatever, but they should listen to you
Yes.
and help you work through it.
Yes. Oh, I feel like we can talk forever, because I really wanted to go into preventative cancer treatments like blue methylene. I've started to, go
methylene
into
blue?
the methylene blue.
Yes.
Yes. And then, but I don't know if you kind of help people with the cancer alongside their cancer journeys, and
I actually
alternative-
don't treat
No.
cancer. I leave that to those docs. There's actually a certification in oncology for naturopaths because it is such a specialized field, and I don't necessarily treat that. But of course, everything we do every day is to prevent that, right? And to prevent the oxidation of our cells. So, typically you do have little cancer cells flying, hanging out in there. But, every day we have the opportunity to detox basically. And detox is taking care of those cells that have been oxidized.
Okay, that's true.
Yeah.
So now how can people find you? Because I feel you're a wealth of wisdom, and everyone should go. So how can they find you? I know you're local here in Arizona.
I am local in Arizona. My practice is Desert Wellness Center in Tempe, Arizona. My website is Dr. Kriss Natural Medicine. And, I run the retreats. You can come to a retreat.
You have one in September
I
coming,
do have
right?
one in September, which is in northern Arizona. It's a lot of fun. And in that retreat, we wind down, we chill out, we do some yoga, we do sound bath. We talk a lot about the mind-body connection, your hormones, your nutrition. And we also go to a little winery. So, it's all very balanced.
I like that. Sign me
But
up.
and the food is 100% organic and locally grown, and the chefs are amazing. So that is a really amazing experience. But for the day-to-day, my office is in Tempe, and you can look up my website. Get Personal with Dr. Kriss is my podcast, and we'll probably replay this too, and maybe even take it apart and do it a couple times, because we
I
can
would
easily
love
do
to.
more than that.
I feel like, I know, I listened to a couple of your podcasts, so much information. So definitely go follow Dr. Kriss
And
Wallace.
my Instagram is a
And
big educational tool for me too, and that's easy,
Yes.
just at
Yeah,
Kriss
I love-
Wallace.
Okay, I love your post. Well, thank you for being here today.
Sure.
I think that's
Thank
such
you.
important information that everybody needs to learn and get more curious.
Well, it's a pleasure to meet you, and you're doing good things too.
Yeah, thank
Very
you.
good.
Thank you.